Hi, we're Group 5 and our STI is on herpes. I'm Lily O'Connell.
I'm Martin Behrens.
I'm Elizabeth Akinyiroye.
My name is Jeff.
My name's Jacob.
Genital herpes, also known as herpes simplex virus or HSV type 1 or 2, affects 1 in 5 college-age students in the United States. Herpes is a condition for life due to no cure as well as no vaccine. There are two forms of herpes simplex virus, HSV type 1 and HSV type 2. HSV type 1 can cause genital herpes, but typically causes oral herpes, affecting the mouth and face. The most common symptoms of HSV type 1 include cold sores and fever blisters. HSV type 2 is different. It also causes genital herpes, only affecting the genitalia. Common symptoms of HSV type 2 include rashes, sores, and blisters in and around the genitals, as well as itching, burning, tingling, and swelling. Herpes has become so widespread because oftentimes people don't know that they have it or mistake it for something else like razor burn or any other kind of rash. Sometimes infected individuals can go years without outbreaks, yet even if you're not currently having an outbreak, you can still pass it along to someone else. These outbreaks are characterized by one or multiple blisters on or around the genitals, anus, or mouth that after a couple of days burst and then last for a couple of weeks. Once they have burst, the infected person becomes especially contagious due to the pus from the open wound. If it is the first outbreak, it is typical to have other symptoms like a fever or swollen lymph nodes, which is just your body's typical response to a new virus, but those symptoms won't recur in other outbreaks. There are a number of options to help manage symptoms such as antiviral pills or cream. Daily use of antiviral medication not only helps prevent outbreaks, but makes you less contagious to your partner. Medication, along with proper use of condoms, allows people with genital herpes to continue their sex life. If an outbreak has already occurred, antiviral cream helps the blister heal up faster. People with genital herpes are more susceptible to HIV due to the open sores the herpes causes. Thus, people with the virus should be more conscious about their risks to HIV. Like all STDs, genital herpes is a big source for anxiety, depression, and sexual embarrassment to many students who carry the disease. According to a study done by Craig M. Roberts from the University of Wisconsin-Madison, there are many ways that genital herpes can influence adolescents and young adults differently than older adults. A lot of patients delay seeking care because they are embarrassed or concerned about their confidentiality. They also feel uncomfortable discussing their sexual experience. Visiting a healthcare provider for a sexual concern without their parents knowing can also be a challenge for adolescents and young adults. Some adolescents would rather pay for the test themselves in order to avoid their parents knowing about it. There are several mental consequences that come along with the diagnosis of herpes as well for adolescents. These include emotional distress, depression, altered sexual response, and disrupted relationship. The European Guideline for the Management of Genital Herpes explains how it is not curable, but antiviral medication can prevent or shorten outbreaks for those infected. Daily use of these medications can reduce the likelihood of spreading herpes to your partner. HSV infections can be managed through prevention strategies as well. Some of these strategies include educating the public on the contagious nature of the disease and the usage of condoms in preventing viral transmission. According to a study done by Roberts, Feister, and Spear, HSV-1 is more common in women than men and is also much more common in people between the ages of 16 to 21 than people aged 22 or older. Also found in Craig M. Roberts' study, young adults account for the majority of newly acquired genital herpes infections, and a large portion of these infections are caused by HSV-1. These college-age students typically have high rates of sexual partner change, engage in higher-risk sexual activity, and might even express fewer concerns about the risk of acquiring an STI. However, current young adults are more informed about STIs like HSV than previous generations. Many young adults wrongly believe that having genital herpes means that they will be unable to bear or conceive children or to experience enjoyable sexual relationships. Once people with genital herpes understand the disease and learn how to manage the symptoms, they can live normal and fulfilling lives.